I'm going to walk you through what really happens when you have part of your colon removed, what it feels like, the recovery, and the things they didn't prepare me for. So, the day before the surgery, I had a little homework I had to do. I had to do a colonoscopy prep to clean out my colon, as that would help with the surgery and the recovery. I could not eat the day before my surgery because I needed to do that colon prep, and I struggled with it. I was already anxious from the surgery and just the general anxiety of having colon cancer that I threw up that solution a few times. And I didn't think I got enough down. I mean, that stuff tastes awful. I remember having a panic attack and actually calling the on call doctor because I was worried that I threw up too much of the solution, that my surgery was going to be postponed because I couldn't do this colon cleanse. How many days would my surgery be pushed out for, right? What does that mean for the cancer that's already in my body that I'm trying to get rid of? I was worried about having to maybe redo the colon prep all over again. I've already thrown this up. Redoing it sounds terrible. I was a complete wreck. I was pacing around the house, basically waiting to go to the bathroom. I was bawling my eyes out. I was scared. Finally, about 8 hours after starting the colon prep, it started working. We're talking midnight. I started that about 4 o'clock the day before. At this point, I had never been so happy to have a bowel movement. I was finally able to calm down just a little bit and get a little bit of sleep, which was much needed. Day of the surgery is here. Somehow I was able to sleep just a little bit. It was very sporadic. I was up and down just from the anxiety, but also having to get up and go to the bathroom as well. So before I left for the hospital, I was instructed to take a shower, and I was given a special soap, basically an antiseptic that they wanted me to use to clean my abdomen and then clean my chest with it as well. The other big thing I was told was to brush my teeth. I cannot tell you how much they emphasized this one. They said, before you come, please brush your teeth. I think I heard more about making sure my teeth were brushed than I did about making sure that I did the colonoscopy prep. Time comes, go to the hospital. I find out the surgeon who's doing my surgery delayed. So I'm starting to pace around the waiting room here, not really knowing how much of a delay. So bunch of pacing, bunch of seeing people eating, seeing some people drinking. Meanwhile, I can't do any of those things. And mind you, I had not eaten at this point for like a day and a half. So a couple hours goes by. I finally get called back to the pre-op room where I get changed in my cute little gown, and I go to lay in a bed while they stick an IV into me and wait some more. Now, this room wasn't too bad. There was a nurse that would come in and check on me from time to time. Bed was pretty comfortable. It had a little TV with some movies and TV shows on it. So I put on a movie and ended up falling asleep for a little bit, which was good. The doctors and nurses would come in and check on me. So we had the nursing staff, we had the anesthesiologist, somebody from the surgeon's team, and then ultimately the surgeon came in, and probably a few others in there. But every time somebody new came in, they would ask me, hey, what kind of surgery are you having? And I'm getting frustrated at this point because when I first got into this pre-op, I had to sign a document that said, this is what you're having done today for your surgery. It was a partial colectomy of the sigmoid portion of the colon. At this point, I'm tired. I'm hungry. I have a headache. Let's just get this thing rolling. I finally get wheeled back 3 hours later than I was supposed to start surgery. While I was getting wheeled back there, I had a sense of relief and I was finally able to relax. I mean, maybe they gave me something, right? I have no idea at this point that I'm feeling this. But what I do know is that I feel like, okay, I'm finally going into surgery. Next time I wake up, I will be on the path to recovery. And that most importantly, the cancer would be gone. So the surgery happens, clocked in at about 4 hours time to get done. And I remember the next thing after being put to sleep for the surgery is waking up in the post-op recovery area. I was coming out of anesthesia, so I don't remember a whole lot personally about this area, but I do remember waking up and looking over and seeing my spouse sitting in the chair. I said some words to her. She probably said something to me. And then I come to find out later that I'm a terrible patient in this recovery room. They had to call in my spouse because I was refusing to eat and drink anything that the post-recovery person that was taking care of me was trying to give me. This is the same guy who just had surgery, and he's not eaten in like 50 hours at this point. Have the ginger ale, have the cookies, have the crackers. You know you need it. And now, I mean, I'm usually pretty good at following instructions, so I'd like to blame the anesthesia on that because I also threw up at some point in the recovery room before I went to my actual hospital room. Now, I did find out later on that that was common. So if the person whoever took care of me or the people who took care of me in that recovery room sees this, I am so sorry for the way that I acted. So somewhere between me seeing my spouse, passing out again, and then waking up in a hospital room. Now, I remember waking up about midnight or 1 a.m. after the surgery, and I had been out for probably about the last 8 hours. And so I was feeling kind of awake at this point, and I was hungry. So the nurse came in shortly after I woke up, was asking me some questions. And at least at this point, I'm a little bit more coherent. She was asking me how everything felt, if I needed anything. And I remember telling her, I go, hey, I know it's late, but I made a request though of frozen yogurt because where I went, I heard from a couple different people that the frozen yogurt in the cafeteria was really good. And now at this point, I had not tried. So at this point, I took my chance and I asked the nurse, I said, hey, is there any chance I could get this frozen yogurt I've been hearing about? And she goes, let me see if I can find you something. So goes out of the room. I no idea how long she's gone. Comes back with this cup full of frozen yogurt, and it was incredible. I mean, we're talking a top 5 meal in my life. And I mean, probably anything would have tasted great. All right. So I eat finally, and I go back to bed for a little bit. And now about 4 or 5 in the morning, I get a knock on the door that I wake up to. Lab coming in. They're needing to take some blood from me. So I fall back asleep, and a couple hours later, I'm up. It's about 6:30 in the morning at this point. Nurse comes in, checks on me, and we're at the first big milestone of me trying to get out of this hospital. And that is the removal of a catheter. So when the time came to remove that catheter, the nurse ended up putting more solution through the catheter into my bladder. Catheter gets removed. I gingerly get out of bed after being shown how to by the nurse so I don't hurt myself. I have 2 incisions on my side and 1 just below my belly button, and I make my way over to the bathroom. Now, I'm scared because I was reading online before I went in for surgery that if you don't go to the bathroom after they take it out, they're going to have to put it back in. And everything I was reading is that that is extremely painful. So I'm standing there with a jug in my hand because I have to show the nurse how much I went to the bathroom. Now, thankfully, I went, and we did not have to put the catheter back in because that would have been terrible. But there's nothing like being a grown adult, urinating into a plastic jug, taking that, and then showing it to another adult and saying, hey, look at what I did. Sometime after my first show and tell with the nurse, the doctor came in. They were making their morning rounds and they asked how I was feeling. They looked at my incisions and asked if I had any questions. And one thing I was told before the surgery was that there was a chance where when they took out that part of my colon, that sigmoid, that where they reconnect it could leak. And if it did leak, I would have to go back in for surgery. So I told the doctor that day making the rounds that I was nervous about it leaking and having to go back in for surgery. And I remember him being very positive and basically saying, hey, it's not going to leak. Now, I know you can't guarantee that, but with how confident he was, it made me feel a lot better. I'm sure he was probably trying to ease my mind. Obviously, he knew that there was this potential for this complication as well. But with the confidence he had and without the hesitation, it definitely was helpful and it made me feel a lot better. So a little while later, a dietitian came in and they were going over some of the softer foods that I should be eating, what my diet is going to consist of in the hospital. And then they got a little upset with me about my current weight. When I went to pre-op, I got weighed. No idea what I came in at. Apparently, that weight was about 10 pounds lighter than when I first started going to that hospital that I had my surgery at to do scans before all this started. The dietitian was not happy about it and grilled me on what happened. I just gave the honest opinion. I was under a lot of stress. a lot of anxiety. I just found out I had cancer. The last thing that is on my mind is food. And then I also said, hey, I didn't eat for 2 days before coming in here for this surgery, so I'm sure that's part of it as well. I got assigned a protein shake with my meals to help bulk back up. The dietitian also said bulking back up in general should be part of my recovery plan, rebuilding that weight. And I agreed. I was thin. He basically said, eat more food, put more weight on them bones. So I went on about my day. I ordered breakfast. I sat in the recliner in the room. I went back to the bed. I took a nap. I had lunch. I entertained visitors. I had dinner. And I'm thinking to myself, I'm like, this is pretty nice. I make a call on a phone down to the cafeteria. Food magically appears, and then when I'm done eating, it magically disappears. I have people coming in every 4 hours to give me my medication that I need to be taking, asking how I'm doing. I'm like, this is a 5-star all-inclusive resort, minus the pool and the ocean, unfortunately. Now, I did more than eating, sleeping, sitting, laying. I did actually go on a couple walks this day as well, as this was another thing that I needed to check off the list in order to get the heck out of there. So the first time I wanted to go on a walk, I had to call the nurse. They wanted to make sure I was stable enough to walk around basically a square area and I wasn't all wobbly, and that they felt that I wasn't a safety risk if I decided to walk on my own. I got my nice non-slip socks on, my gown tied in the back, and I'm ready to stroll out and about on the town. So I walk out of the room very gingerly, and I kind of shuffle my feet around the square a couple of times. Now, it's not very big. I mean, you're talking probably 50 steps just to make it around the square. So I did that a couple times, and then I went back to my room. A little while later, I got up again and wanted to walk and made it around the square with the nurse again. And they said, you know what? You can do it on your own. All right. We're ticking off some boxes here, and this is day one. These walks did some wonders because I had a bowel movement. And why am I so excited about a bowel movement, you ask? Well, I just had colon cancer, and they took out a part of my colon. But apparently, it can go dormant a little bit after surgery. And so they want to make sure that it's working properly so that you're going to the bathroom as you should. And it was another bathroom show and tell moment. The first time I went to the bathroom, I had to call the nurse in so they could see what I did. Thankfully, I didn't have to do it into a plastic jug or container. They just had to come in and look in the toilet to make sure I could make, I guess. And I'm curious, so I asked them, I'm like, what are you looking at? Because that sounds terrible. And they said, hey, we just want to basically make sure that there's not a ton of blood in it. And I said, all right, it makes sense. I mean, I did just lose part of my colon, so blood in there probably makes sense, even though that's what started this whole thing. At this point, I've pottied all by myself, and I'm up and walking on my own. I am growing up so fast. Pain overall on day one was very manageable. I was on a rotation of a couple different pain meds, ibuprofen and acetaminophen. I would get a muscle relaxer in there, and then I had the option of oxycodone if I needed it, 5 milligrams or 10 milligrams, depending on my pain scale of the 1 through 10 chart. And the oxycodone, I was a little nervous about because I did read that that could be addictive, but I did take it as needed. Being at the 5-star resort did come with some issues. I was doing great all day. Then I decided I'm going to go to bed. So I was sitting in the recliner in the room, got up, went like the 3 feet to the bed, and I went to sit down the special way that the nurses taught me how to slide into the bed so I don't hurt myself. And I have no idea what happened. My shoulder had been aching for the better part of the day. And I was told, since I had laparoscopic surgery, that was a common side effect. There's gas that they use to inflate your stomach. I was told that my stomach was inflated to basically being 8 months pregnant. And some of that air gas gets trapped and it's kind of just got to work itself out. And then there's a nerve somewhere in your body that it can hit and that can cause it to ache. The pain was more of an annoyance most of the day. It wasn't anything unbearable. It was just always kind of hovering around maybe like a 2 out of a 10. But when I went to go and lay down, I have no idea what I did. I don't know if it was the shifting that caused some of that gas in there to change up, or I just laid down on it wrong, but I was in the worst pain I had ever been in my life. I remember calling the nurse in. They're asking me, okay, on a scale of 1 to 10, what's your pain tolerance? And I'm telling them a 10 because this is terrible. So they go out of the room. They come back in probably 30 seconds later, but it felt like a lifetime, saying, all right, we put in an order for something at the pharmacy to help you out. And so, again, what felt like hours, but was probably just a few minutes, the nurse came back in, was administering that to my IV, and the pain was going away. It was quick. I mean, we're talking seconds from when that was first administered to me feeling it. Day 2 starts off pretty similar to day 1. We have labs coming in the morning. I pretty much just wake up for the day because it was probably like 4 or 5 in the morning. I'm like, whatever. I had enough. Time doesn't matter right now. And so a couple hours later, the doctors come in and I'm sitting up in the recliner. And they go, hey, we like to see it. We like to see the patients in the recliner instead of just laying in bed. And they're talking to me about how I went to the bathroom on my own. I'm getting congratulated like this is some big feat that I just accomplished. Hey, good job, buddy. You went number 1 and number 2 on your own, and you made it to the potty in time. Congratulations. We heard you're out walking too. Thanks, Doc. They were really happy with the progress I was making, legitimately. And so they asked me in the morning, they're like, hey, do you want to go home this evening? Now, mind you, I just had a colon resection. I had a foot of my colon taken out like 36 hours before this. And the doctors roll in and they're like, hey, we love what we're seeing. Keep it up. You want to break out of here this evening? Go for it. And I absolutely said, yeah, let me go home. So I had breakfast, napped a little bit more, went on my walks, continued being great at going to the bathroom. And by the time evening came around, I got the official nod that, hey, you're going home. Shortly after, my chariot arrived. It was a beautiful wheelchair that came in to pick me up, to wheel me down to where the car was that was going to take me home. We did make one pit stop, though, and that is at the pharmacy because I needed to get my pain medications that I was going to be using at home. Make it all the way down to the car. I get a little pillow at the pharmacy as well that I put over my stomach. So that way I can put the seatbelt over it and the seatbelt doesn't rub on the incisions. And it worked. But the part I wasn't prepared for was feeling every single bump riding in the car. But a part of me just didn't care either because I had the windows down, I'm breathing in fresh air, so I make it home and I start the recovery process at home. And I'm going to be talking about that in another video. Hey, my name's Matt. I'm a colon cancer survivor. I have a genetic mutation called Lynch syndrome, and I'm documenting my life as best as I can living with this increased cancer risk. And I hope to catch you on the next one.